Everyone, it's Dr. Mandy, and I am back for another podcast. And here I actually stumbled upon this person, Dr. Stiles, on TikTok, of all places. And I was very intrigued because he was saying a lot of things that I say, and it's very rare to find a urologist who speaks in this manner. And so I was very intrigued to reach out to him to learn more about him and bring him onto this podcast. So, quick summary, he has 20 years of traditional experience with urological surgery located in Florida. And now he's doing functional medicine and treating bladder issues. Particularly, I've found he's treating IC holistically using functional medicine. So I want to go ahead and get started with getting him introduced. Hi, Dr. Stiles.
How are you?
Good. It's great to meet you. So tell the audience here what led you to start treating IC from a root cause perspective instead of the traditional method. And you can talk a little bit about what the traditional method was for the people who don't have experience in that.
Yeah, so I am traditionally trained as a urological surgeon and spent about life doing that. And then my story is I actually got sick and my health was way down and I was unable to work. And then the pandemic happened and no one could fix me. And so I went on a journey to learn about all the things that I didn't get taught in medical school. And, for me, it was a life or death situation where I had to learn these things so that I, you know, could be healthy. And what I learned blew me away. And a lot of it is based on the advances in technology and the advances in our abilities to learn about how the human body is functioning. And when we know how the body is functioning, now we can start really doing some things that traditional healthcare is just not able to do, like in as a traditional urological surgeon, you have a toolbox, and that toolbox is surgery and pharmaceuticals. But in this integrative space, now we have again advances in technology for labs and learning about the body. We can build the body. We have nutrition. We have probiotics. Um, we have botanicals. We have all these new tools that we can use to help build people up. And, when I started working with people, I'm sure you see this in the people you work with, it may take a little bit of time, but the results are transformational.
Oh, absolutely. And that includes myself because I suffered with IC too. So, and that was my journey as well. I got sick and no one could help me. So I had to help myself. So what is the biggest misconception that patients and
Yeah.
doctors have about IC?
What's that?
The biggest misconceptions patients and doctors have about IC.
One, I think it's a lot of people think it's just a bladder issue, and I am firmly believing that it is a whole body issue. It often affects the gut. It often affects the brain. It often is affected by hormones and nutrition and pathogens and oxidative stress. And, it's the whole body is affected. So that's probably the first misconception. And then the second misconception is that people can't get better. People are told you're stuck with this. You just got to manage these symptoms. You have to just deal and live with this stuff. And unfortunately, it removes hope from a lot of people being able to get better from something as complex as I see.
So when you work with somebody for the first time, what are some clues that tell you you got to dig for the root cause? Is there something that screams at you, the first thing?
I mean, IC is really complex. There's 7 or 8 different subtypes, and so really, I like to first just identify what their main issues are. Is it inflammatory? Is it infectious? Is it pelvic pain driven? Is it frequency driven? Do they have gut issues? How is their brain? How is their energy? How are they sleeping? They just look coming at it from a whole body perspective. I think that's step one. And then utilizing some of these advanced tests. And, I always look at IC in 2 categories. One is because it's so highly associated with gut health, I usually start focusing on the gut, focusing on food sensitivities, and focusing on even yeast overgrowth can be a common driver for IC. So I usually start there and get that piece working right, and then the second piece is dialing in more specific with the bladder and the urinary issues.
So functional testing, do you do stool testing or anything?
Yeah, so again, this is not something you're going to get at your urologist's office. Most urologists do not know how to read a gut test, and it's because it's a completely different system. But now, when you understand that these two things are related, yes, to me, the gut test tells you, it gives you the roadmap to get out of some of these cycles of inflammation that can keep people stuck with IC.
So back to the gut. Great topic, actually. I think you're right. I think it's also bidirectional. I think it's the brain, the nervous system, and the gut, and they crosstalk. They talk to each other. And I do think that stress plays a big role. I know for me personally, it has. I just had a baby in December, and I was in remission, and my symptoms started coming back. And I
Mhm.
was like, wow, look at this. This because I had a baby, my hormones, stress, baby's not sleeping. I mean, it was a whole thing. And I think that affected my gut because at the same time all this was happening, I had chronic diarrhea for like 2 months straight. So there
Mhm.
you go, boom, there it was. And so I knew knew what was going on, so I had to work on repairing it. Can you talk a bit about this gut brain bladder access from what you've seen with patients?
Yeah, so I think the gut gets imbalanced, and the gut is I talk about it as being like the rainforest. It's 40 trillion bacteria. It is very complex, and when certain things are overgrown, like bugs, what those bugs can do is they can activate the immune system, and they can activate IL-6 and IL-8 and TNF alpha and all these inflammatory mediators, including histamine and leukotrienes and all these things that come in when there's inflammation. And what it does is it activates the brain, and it causes glial activation in the brain. And now the brain starts sensing pain at a higher level, meaning something that would normally be a 1 or 2 out of 10 with pain. When you have glial activation, now your body is perceiving it as an 8 or 9 out of 10. So, like that to me, that's the brain piece. And that's why, I see people tend to be very sensitive. And a lot of that is because you have this issue driving the gut, and the gut is driving the brain. And if you can break that cycle, that's one of those key steps in resolving the inflammation.
So you talk about glial activation. So from your experience, what do you have a high percentage of patients who have had a history of trauma?
Absolutely. I mean, I
Okay.
probably say that's 90%. Everyone is different. But we all deal with different issues. And I see people can certainly have traumatic issues that can precipitate IC and keep IC in progress. And yeah, trauma plays a part, there's no doubt.
So we're talking upstream now. Let's go a little downstream here because that's all upstream stuff. So now we have actual information that I actually started seeing 10 years ago when I first got diagnosed, when I was working with Ruth Chris, because she actually was my practitioner at the time when she was still in practice. And we did something called Pathnostics, I think it was called, but now it's MicroGenDX testing. But back then it was a different name. We were doing the molecular testing. We found out there was biofilms. So can you talk a little bit about what you're seeing as far as the urine and the vaginal microbiome? I do believe the gut is the source, but then it creates the imbalance in the vagina and then the bladder. I think it goes in that order. What do you think?
I mean, a lot of people think there's biofilm in the bladder. I'm not so much of in that camp. I think it certainly can in a minority of people, but I think the biofilms are more likely to be in the gut. And it's the gut biofilm that causes the bladder issue. But um, biofilms can be an issue. There's no doubt about it. It's the pathogen's response to wanting to stay active in the body. And if you have a gut biofilm, your body's likely gonna notice it to some degree.
Yeah, I know. That's when I learned in microbiology was biofilms are normal. I have to tell my patients that because everyone thinks they're evil. I'm like, they're not evil. You need them. They're part of your microbiome, right? But I think, I guess I think that at the end of the day, I think dysbiosis is the problem. And I do have seen a lot of women have, especially after menopause, they don't have any more lactobacilli in their vagina anymore. It's gone.
Yeah,
You see that as well?
absolutely. I mean,
Yeah.
lactobacillus and a bifidobacterium, those are the good gut in the bacteria that are the good cops that run off the bad stuff. And no doubt, if probably 85 to 90% of the women that we do gut testing on have significant decreases in lactobacillus and bifidobacterium.
Or completely gone, right? Absent. Yeah.
Absolutely.
That was me. I had none. Zero. And that was because all the antibiotics I took as a kid.
Yes.
Ah,
Yes.
strep throat.
Yeah.
Little did we know back then. Now it's like now we're smarter. We know like let's be a little wiser with how we use these antibiotics.
Mhm.
Alrighty, so gut health, I know that's a big one. So what are some key steps that you like to do with restoring gut health in your IC patients?
Yeah, so we start with first we want to know what to eat. There's a lot of misconceptions with, you got to be on this icy diet or this anti-inflammatory diet. But what I do is again, I like data. And so I use food sensitivities and actually targets and tells me what are these people reacting to. And so, I use food sensitivities first line to find out and kind of personalize a diet for people. And then working on digestion, especially if the gut zoomer or the gut test shows incomplete digestion, this is one of those pieces it's commonly overlooked, the importance of just simple digestion. So digestive enzymes are important. Chewing your food properly is important for digestion. Um, and then supporting the gut, and I support the gut with, very gentle probiotics in the beginning. I support the gut with colostrum and immune agents. I support the gut with just a different, a lot of it just depends on what we're finding on the gut test. We want to support first before we start killing a bunch of agents. I mean, that if you start out and you start giving someone something like oregano oil or garlic, you're going to set off a bomb. And, that's often not the best course. You usually want to support for a couple of months first, get the detox pathways open, stabilize digestion, support with nutrients, before we start, targeting certain pathogens.
Yeah, I'm glad you said that. That's exactly what we do. So that's why I like to do the HTMA test first because I can get some information on supplements that they could use to help boost their immune system nutritionally. Because minerals are everything, and so are the vitamins, and many people are very deficient. So I always tell people, well, let's build the foundation first, because you're right. Like sometimes, like, even functional medicine doctors, they go in and they throw bombs at people,
Yep.
and these people they can't handle it. They're already like depleted, and then they get knocked off, and they're having a die-off reaction. They can't get out of bed. They end up hating you. And I was guilty of going through that process myself when we first I was getting treated. I had such bad die-off, I couldn't even function sometimes. My head would be like spinning and I'd have brain fog. It
Yep.
was terrible. And I don't like doing that to people. So I'm always like, 'cause sometimes they come to me and they want this. And I'm like, I don't think that's smart. Let's not do that. So I'm glad you said that. Build the foundation.
There's a lot of education that needs to go into, like when you work with people, as you know, education is the most important piece, and it's helping them understand that there's not usually one simple fix for this. It is a process. It is a properly sequenced program or a process that you really have to walk them through in order to start seeing these results that we want. Unfortunately, there's no simple, easy fix for, when the body is just completely out of balance.
Yeah, agreed. Yeah, for sure. I tell people you didn't get here overnight,
Yeah.
right? You can't expect to be. I mean, I think sometimes because they're still thinking conventionally that they want and I get it. We're in pain. We want to get out of pain. So speaking of that, when someone comes to you and they are in a lot of pain, but you know it's going to be that they're in for the long haul and it's going to take a while to reverse, what do you do initially to help reduce their pain levels? What are some of the strategies you use?
Well, in getting back to, we're talking about glial activation, you have to get the gut balanced and you have to settle the gut down to turn off this glial activation. Otherwise, they're going to struggle with pain. There are certainly botanical anti-inflammatories that can be helpful. There's all different types of things you can do, but number one is getting that gut right.
So, speaking of that, could you have some examples of some success stories that you were able to address the root cause and were able to get people to heal their bladder?
Yeah, so one of them that comes to mind is a 42-year-old gal that has struggled with IC for about 5 years or so. She had tried everything. Bladder inspection was normal. Tried some of the anticholinergics, tried amitriptyline, and tried some, Elmeron and things like that. And just nothing was helping. And she knew that it was, other parts of her body were contributing. And so, with the testing that we did food sensitivities, and right off the bat, she was severely allergic to milk and dairy and yogurt. And what was she eating every single night was a big bowl of ice cream. And so we take that out, and immediately her pain drops 30 to 40%. She was severely low in omega-3 fatty acids. You want your level, upwards of 8% or so, and she was about 2%. So her cells didn't really have that phospholipid layer that helps with the transfer of waste and nutrients getting into the cell, and even hormones and things, they were off. So she had serious food sensitivities or allergy. She wasn't digesting her food. She had leaky gut, and she had overgrowth of yeast. And so again, just walking her through this process of getting things out of the body that are harming it and putting in superfoods and putting in good things into the body. That was life-changing for her. And at month 4, her pelvic pain completely went away.
Nice.
Yeah. So, that's a little quick. I'd say most people range anywhere from, it may take anywhere from 6 to 9 months. So I think she
Yeah.
got
What I
through.
always say, 6 to 9 months. Very nice. Yeah, that's exactly what I've always said, 6 to 9 months. So
It,
we're on the
it
same page with that.
people have to understand that one, it takes time, and two, you're not going to get this type of care in the doctor's office. Like this is completely different. Insurance is not going to pay for this. They're not interested in getting you healthy, unfortunately. And when you enroll in a program like this, I look at it as an investment in your health. You're investing in your health, you're investing in your future, and you have to be willing to do that in order to get these answers and, ultimately get better.
All right. One piece of advice you would give someone newly diagnosed who wants to heal naturally. What would that be?
That you can do it, that there's hope, that that it can be done. I mean, it doesn't have to be a sentence or a prison. It can be improved, but it does take, it takes work. It takes doing some testing usually to find out what's going on and having a plan.
Agreed. Yep.
Mhm.
So are you located remotely as well?
Yeah, I see right now I see 100% of people virtually. So
Virtually. Okay, good.
I work with men and women, and yeah.
Good. And so how do people find you?
Website is drwilliamstiles.com, and fill out a contact form, and that's usually the best way to reach me is through that contact form through the website.
Great. Well, this was great. It was a nice meeting you. I'm glad I ran into you on TikTok. Keep on
Yeah.
posting.